Hello everyone, welcome to this video in which we are going to evaluate the usefulness of point-of-care ultrasound for assessing the nephro-urology diseases, mainly affecting to the kidney and the bladder. Before starting, we need to remember a couple of technical details that we need to use before using the ultrasound machine. First of all, we need to assess or we need to choose the right transducer or probe you are going to use for the evaluation of kidneys and bladder mainly. So as we know, there are different transducers, there are different applications of these transducers, and in this case, we are going to use the convex probe, which is in the right side of the screen, upper right side of the screen. This transducer offers us good penetration, which is totally necessary to evaluate the kidneys and the bladder, and we can sacrifice a little bit of resolution that can be not too necessary in this case. Remember that any time we are going to cut our patient into a transversal axis or a transversal view, we're going to point the probe marker towards the patient's right. When we need to assess the longitudinal axis, no matter if it's a pure sagittal or a coronal view, we are going to place the probe marker towards the patient's head. The anatomy of the kidneys. The kidneys are two organs, obviously, and they are mainly in a posterior location. In the abdomen, they are placed in the retroperitoneal space. The length of the long axis of the kidneys are plus minus 12 centimeters, and there's a transversal or perpendicular to the long axis, which is more or less 6 centimeters. Actually, these measurements are mean measurements, but for sure 9 centimeters of long axis kidney will be small, and in a transverse view or of a kidney that measures like 3 centimeters will be small as well. Where are the kidneys? Where do I need to put the probe to find the kidney? For the right kidney, it's much better to place the ultrasound probe along the mid-axillary line, mainly at the level of the last ribs, with the point marker towards the patient's head, as usual. But remember that the left kidney is a little bit more posterior and superior than the right kidney. So we need to go really posterior to assess the left kidney compared with the right kidney. The sonoanatomy of the kidneys is really easy to assess because there are two structures with a particular echogenicity. They're surrounded by spleen or liver, depends if this is in the left or in the right side, and there are two different components inside the kidney itself. The cortical one, the outer layer of the kidney is the cortex, and the inner part, which is more hyperechoic, is the medulla. Of course, this distinction between cortex and medulla is mainly ultrasound based, but as we can see here in this clip, is totally true. There's something black inside, which is anechoic with a tubular appearance as well, that can be easily identified with Doppler or color. These are vessels, the veins and arteries coming to or coming from the kidney. For assessing, for instance, the right kidney, it's better if you place your patient into a left lateral decubitus. And if you place a pillow in the left lateral part of your patient, the intercostal space will be more open, more accessible to assess and to evaluate properly the kidney. Another trick, if you don't see the kidney, I mean, if you see the liver, or if you see, especially the liver, but if you see just something weird in the left side, go more posterior. In some occasions, that are important percentage of patients, the right kidney is not exactly in the mid-axillary line, but in the limiting between the mid-axillary line and the posterior axillary line. And the left kidney in some patients can be even more posterior than the posterior axillary line. Regarding the pathology, for assessing point-of-care ultrasound, under the point-of-care ultrasound definition, there are only a few diseases, a few abnormal conditions that can be evaluated with ultrasound. And the main one is the hydronephrosis. Hydronephrosis is actually a really accessible condition to be evaluated. And especially the degree of this hydronephrosis is really important clinically. So the hydronephrosis is the dilation of the collector system with a secondary compression of the parenchyma, of the kidney parenchyma. This can be mild, like in this case, you see something like black inside the collector system, inside the medulla of the kidney. If you place the color, there will be no color, no Doppler signal inside. And so for doing kind of a differential with vessels, with normal vessels. For moderate forms, like in this clip, in which it's really obvious, you see perfectly the dilation with the compression of the medulla of the kidney. And for severe hydronephrosis, like in this case, you won't be able to see the normal distinguish between cortex and medulla. There's a lot of compression caused by the hydronephrosis, and of course there will be a lack of kidney function in this case. We need to move with the clinical information always, but for sure assessing the size of the kidney will give us a clue about if the disease or the condition is well established. I mean, if the disease is chronic, or it's a recent condition, a recent abnormal condition, especially in the acute settings of kidney diseases. The second organ we are going to evaluate is the bladder, mainly for assessing one particular condition, which is the urinary retention, that in some cases, especially in obese patients, can be super challenging. The anatomy we are looking for is super easy. We know that the bladder is an infraperitoneal cavity, infraperitoneal organ, which is full of fluid in general, in normal conditions. We know that in male patients, the inferior part of the bladder is related to the prostate. For assessing the bladder, we can use both approaches, the transversal view and the longitudinal view, but we need to point towards the inside the pelvic cavity, which is actually the place where the bladder is. As well, before scanning, we need to take in mind that the probe that we need is a convex probe, we told you before, and especially to adjust parameters. The gain, we need to be careful with the gain. The bladder, which is supposed to be full of fluid can cause a higher posterior acoustic enhancement than normal. So we need probably to decrease the gain a little bit more than we used to do, and especially the depth, because in some cases the bladder will be superficial. The orientation, for telling it again, could be better to do both, a transversal view and a longitudinal view, sagittal view. This is the appearance of a large bladder. When you that the bladder is infraperitoneal, and the black stuff inside the anechoic structure is pure fluid. So tips and tricks again. Remember this thing: the bladder is inside the pelvis, and if we need to evaluate what's inside the bladder, it's much better to ask our patients to pee better prior to doing the ultrasound. So the quantity, the amount, the volume we need to measure, we need to assess, will be the post-mictional residue. For calculating the amount of fluid, the volume, total volume of fluid of urine inside the bladder, there are different formulas, and we need to just know just one, and this probably will be easier. In the left side of the screen, you see the transversal view of the bladder. So the A distance multiplication by the B distance. In the right side of the screen, the second picture, we are measuring the maximum distance in this, the maximum diagonal from head to feet, which is the C measurement. So A plus B plus C plus one half will give us a quantity in milliliters. So we need to take in mind that placing a catheter will be an option if the post-mictional residue is, to give just an idea, more than 100 milliliters. And we already finished. This is the two theoretical concepts we need to know before the classroom. So thanks for watching. Bye.